Okay, as you all know, the newest stroke 2026 guidelines have been released. And while we make a detailed video regarding this, if you all want, just comment in the section so that we can make a detailed video on this. But when you are reading this by yourself, three terminologies or three scoring system you will come across and understand the significance of that. The one is the aspect score. It stands for Alberta Stroke Program Early CT Score, ASPECTS. So basically, what it does is when they look the CT scan of the brain on the imaging CT scan, they have allocated different points, total of 10 on to the CT scan. And the more the area starts involving, it's usually for the mid cerebral artery area and also for the posterior circulation also nowadays. So as soon as the area starts involving on the CT scan, they start deducting. That means they start taking it, and the score from 10 starts decreasing. So a lower score means more of the area is involved on the CT scan imaging part. So if they say that the aspect score should be less than 6 or equal to 6 means there is some area of the CT involved on the imaging. If they say that Alberta score of less than 3 like that, that means the more the area is involved on the imaging, you are able to see it on the imaging. So that means that if aspect score is low, that means more of the area is actually damaged on the CT scan. So its recoverable chances are less. Secondly, the which they will use the terminology is mRS, modified ranking scale. It's a scale of disability. 0 means perfectly fine and 6 means dead. So disability is start from whether able to do daily activities independently or depend on someone. So you need to understand that for a patient, if suppose the stroke involves the vision, then vision may not be manifest as hemiplegia or something like that, but it is disabling for the patient. Suppose a patient living is on the paints and earns his living, and the right hand is involved in it. So if only the right hand is involved, the patient is disabled for that matter. If the left is involved, we won't say that it that much disabled, but the working hand involved, it's more disabled. And the third, which will be used, is NIHSS scale, which you also know, National Institute of Health stroke scale. So higher the NIHSS scale means more the areas involved, more the focal deficits are there. So you need to combine all these three. What is the CT imaging? What is the disability? And how severe is the stroke? Based on that, the guidelines are made. So when you read that, interpret it in that direction. How much there is a localized lesion on the CT, but the disability is more like that. Hope this helps. Do read more about it.